been unmuted. Hi, everyone. Thank you very much for joining me and our guest speakers here today. I am Assita Kanko from the ECR Group. I want to welcome you to the ECR webinar on the EU and Africa in a post-pandemic world. The EU-Africa relationship is one of huge importance. With the adoption of the new EU-Africa strategy, our close cooperation and communication on the key challenges and opportunities we face is vital. Today and tomorrow, we will be exploring how we can meet the challenges of COVID and the post-COVID world as partners. There will be panels on pandemic responses and the health situation, the influence of global actors on Africa and EU-Africa policies, the pandemic and its challenges to democracy, fundamental freedom, and good governance, and women's rights and the impact on the pandemic. Our first panel discussion today will focus on the pandemic responses and the health situation. COVID-19 continues to be a severe burden on healthcare systems in Europe as well as in Africa. Many countries are experiencing healthcare product shortage in already often unprepared healthcare systems. Access to adequate medical equipment is a challenge in low and middle income countries and is an issue that needs to be jointly considered in preparation for future pandemics. Due to the global health crisis, humanitarian and development aid has also seen a shift in priorities to adapt to the current situation. Today and tomorrow, we hope to delve into how best to enhance health sector resilience, to better manage the ongoing pandemic, and to prepare for future similar challenges. It's my pleasure to welcome our two esteemed panelists. First, Beverley Schäfer, Deputy Speaker of the Western Cape Government, and Mountaga Keita, who is founder and managing director of Tulip Industries in Guinea, who is delayed but will be joining us very shortly. Following the interventions of our guest speakers, we will be taking any questions which you may have and discussing the main themes from the presentations. I would like to welcome now our first speaker, Beverley Schäfer. Hi, Deputy Speaker of the Western Cape Government. Welcome. Ms. Schäfer is currently Deputy Speaker of the Western Cape Provincial Parliament. She was appointed as the Minister of Economic Opportunities, Tourism and Agriculture for the Western Cape Government. And prior to that, she was the Standing Committee Chairperson for the Economic Opportunities, Tourism and Agriculture. Her interests include leadership, governance, and applying design thinking and innovation to solve social and economic challenges such as unemployment that countries like South Africa has to grapple with. We are honored to have you here with us today. Thank you for joining me.
Thank you very much, Anita.
The floor is yours.
Thank you. So to all the honourable members of the European Conservatives and Reformist Group, ladies and gentlemen, special guests. On the 15th of March 2020, President Cyril Ramaphosa declared a national state of disaster in terms of the Disaster Management Act in order to integrate and coordinate disaster management mechanisms to prevent and reduce the outbreak of COVID-19. And on the 23rd of March 2020, announced that we would be placed under a nationwide lockdown. South Africans were legally bound as a result then to stay at home during this time, and the borders were shut. We called that level phase 5 of the Disaster Management Act regulations. Soon after that, in Parliament, an ad hoc committee on COVID-19 was established by the Speaker in the Western Cape Provincial Parliament, which is a province of South Africa, on the 14th of April 2020, in accordance with our standing rules of our provincial parliament. It was one of the first parliaments, I guess, in the world. It was certainly the first one in Africa to be given the assignment to perform oversight over the work of the Provincial Executive Authority as it responded to COVID-19, including oversight over any part of the Provincial Executive Authority, any part of the provincial department, any provincial organ of state or any provincial entity that was going to be involved in activities dealing with the pandemic. On the 17th of April 2020, the committee then adopted 12 central themes of which it would conduct its oversight work over the government response to COVID-19, also agreeing to hold meetings every single week due to the urgency of the matter. And those themes centered around the health department response, which of course was the most important, policing, security and police brutality, which we saw was on the increase, food security, which was an absolute pandemic, the protection of the vulnerable, the disaster management in itself and the local government oversight, the economy recovery, the support and the livelihoods of people, the transport and infrastructure space, schooling and education, human settlements, citizen surveillance, intergovernmental relations, and government finance and budget. That became an ongoing committee while government was actually responding. But what I'd really like to bring us back to is how the health department actually responded in particular during this time of lockdown. Now, one of the first things that our health department discovered was the concept of high flow nasal oxygen, which resulted in many more recoveries from the disease than our fellow provinces across South Africa. They were the first to use high flow nasal oxygen rather than the use of ventilators in both high care environments and in acute environments. At the peak, the province was using approximately 62% of its daily oxygen allocation and therefore managed to ensure that oxygen supply was adequate for what was needed and did not experience strained oxygen supply like our other provinces in South Africa. The Premier acted incredibly responsibly by taking the public into his confidence from the very start on the good and the bad news at every single step of the way. A sophisticated data system was developed to track infections over time for a data-led strategy to fight COVID-19. This was shared on a public dashboard to keep citizens regularly informed. The dashboard in itself won the Silver Award for the best use of technical innovation in the 2020 New Generation Social and Digital Media Awards, the only government department shortlisted in any of these award categories. We also established 3 very state-of-the-art field hospitals which were built, which were recognized by leading epidemiologists as success stories of effective leadership. The conversion of our Cape Town International Convention Center, which formerly was a state-of-the-art business center to attract international conferences and congresses, was made into a temporary hospital facility and provided an extra 850 additional beds. And what was very interesting about the center is that it was a paperless center. In a very short time, within 6 weeks, we were able to establish a state-of-the-art center that involved no paper. Every bed had its own iPad, and every iPad was connected, enabling patients who were recovering from COVID to be able to speak to their families, who of course were not able to visit them, but they were able to communicate effectively. Also that was established was medical interventions around diabetes, because as we know that diabetics were the highest at risk in terms of COVID deaths, and a diabetic project was established by the Department of Health, which brought the mortality rate amongst diabetics from 28% to 4.5%. In addition, the Western Cape government, in conjunction with the City of Cape Town, our largest metro municipality, as well as other partners, developed systems to monitor outbreaks through screening of wastewater. And I believe that that is one of the most innovative projects that this province has undertaken, because even today, we don't have to test to find out how quickly the COVID-19 is spreading amongst our communities or amongst our towns. We just test the local wastewater system and are able to determine an increase in COVID-19 cases or not. The Transport Department of the Western Cape established what they called a red dot system in the April of 2020, which was solely created to transport healthcare workers and over 70,000 passenger trips, over 1.1 million passenger kilometers, and completed over 10,000 passenger trips, basically to ensure that healthcare workers, through the use of an app, could be transported from their homes to the healthcare facility safely. Those taxis and minibus taxis, as we call them in South Africa, were assisted by government by being obviously sanitized on a daily basis. A whole of government approach was established, and those healthcare workers were safely transported, as I say, with 70,000 passenger trips over the period of time. The other intervention that we found worked extremely well was the hotspot strategy in the department. We could isolate where we found a resurgence of the pandemic, and we would then hotspot the area and manage the area effectively. It worked far better managing hotspots than shutting down entire towns, entire cities, and entire provinces. So those were some of the big areas that health had to respond to, and how health used innovation throughout its time during the worst phases of COVID-19. And I must say that during that time of lockdown by the national government and by the president himself, you know, there was a massive result on business, as we saw across the world. But in South Africa, and in particularly in our province, we lost an estimated 1 billion rand per day during level 5 of lockdown. And as a result of that, have seen an incredible impact on business, even up to today, where we're sitting on level 1 and at level 2, waiting for a resurgence of possibly a third wave. But I can talk after this about business and about how we're trying to get a recovery phase in process, but really wanted to just touch on where we had come from and how we had responded to the pandemic. Thank you, Anita.
Thank you very much, Beverley, for sharing your experience and also all the innovative projects that have been undertaken. It's very impressive. I think that there are so many dimensions to this issue, and we have so much to learn from each other. My experience and my feeling is that in the past 12 months, perhaps Western countries forgot to look at Asia and to look at all the good work that was done in Africa. And I think that this form of this attitude is a little bit close to having a single approach to a situation, whereas African countries have tackled so many issues over the past years is actually wrong. We should really change this way of doing. And your presentation is illustrating that again very well, especially we are facing the same challenges like for business, like the fact that we need to innovate, that we need to take people who are affected by diseases like diabetes into account, look at unemployment and scarcity in terms of assistance, and of course, a lot of loneliness. And so I don't know if our second guest did arrive yet. I think no. So I would just ask you this question. Perhaps what we did not address is loneliness during this period of COVID-19 that is still going on. People might maybe think that it's different in Africa. The way I grew up in Africa is that we stick a lot together, but maybe during COVID, the experience was the same as you could observe in the West. Maybe you can share your experience on that and how you address that aspect, because it's also part of health to go through this period. And another point another question I would like to ask you is how has been the coverage? Did you see what happened in the EU about the vaccine, and what have been your opinion on watching that from your perspective about the EU's own vaccine role? And what is the current perception about that? And then I have a couple of other questions, but I will let you answer these ones first.
Thank you very much. I think mental wellness has really taken its toll amongst all parts of society. I mean, I would even say that politicians, government, local citizens, even our homeless, mental wellness has really been front and center. We are seeing more and more people in need of assistance and social work. We know that gender-based violence has increased dramatically as a result of people being stuck at home. It was one of the reasons why, for example, the Western Cape government continued to invite children to come back to school, not for school lessons, but to come back and being fed, because we also understood that linked with mental wellness, unemployment rises, gender-based violence, and children not getting food, we were having a disaster situation right on our doorsteps. So that is an ongoing process, Anita, because we are seeing the effects of loneliness and mental illness as a result of more than a year of being isolated. And that cannot be underestimated and isn't a continuous process, as I've said. With regards to the vaccine rollout, one of the things the Western Cape government did was, although we were not mandated or being allowed to procure our own vaccines, we did at a very early stage with our sister partnerships across the regional partners, with our sister countries as a province, basically approach all governments to find out if there was any excess vaccine opportunities to purchase. And so we've done a lot of work in the back end to find out where those vaccine sale opportunities are, and are continue to pursue those vaccines for future purchase. As we know, many countries purchased more than one vaccine per citizen, sometimes up to 3, and those vaccines are usually only allowed to be sold on a government-to-government basis and not to the private sector. So we've taken initiative to look at the opportunity for that. The second real failure of our national government has been the very late wake-up, and it was only through the press and public pressure to realize that our national government had not negotiated with the big pharmaceutical companies in time, and were left scurrying around trying to find vaccinations for our citizens. To date, we have done a very, very, very small percentage of vaccine rollout with J&J, and of course with all the, and in fact, with all the pressure and with all the new information coming out around vaccines, such as those from Johnson & Johnson that have been stalled, we are obviously on the last receiving end. We don't perceive that we will get any or get a majority vaccination of our nation by the end of this year. We are extremely concerned about that as a government in the Western Cape, and as a political party. We certainly do believe that we should be vaccinating as quickly as possible in order to ensure that we don't have a massive impact of a third wave that will actually create and cause more deaths in our country.
Well, it's so challenging that we saw the pandemic coming and the world looks so unprepared. It's so worrying. I hope we'll be able to speed things up. Then it brings me to my next question, Beverley. I wonder, how do you, based on your experience and what you have been observing and perceiving, how do you think the EU can work with African countries in order to create a better or quicker vaccine rollout that is workable on the ground? And I must say that I do feel a bit guilty asking this question, because the EU did even not succeed here. But obviously, at global level, we need to make sure that everyone is at a certain point vaccinated. Otherwise, we will not get out of this pandemic situation. And what can we learn, in your opinion, from previous vaccination rollout? Because you've had probably some experience on that. Like, when we speak about polio, for example, I mean, when I learned first about vaccines at school in Burkina Faso, they looked at your hand here, and all of us have this mark, which proves that we had a vaccine as a baby against tuberculosis. That the first thing that happens when you are born is that this happens to you, and then you are protected. So obviously, African countries do have serious experience about tackling this kind of issues. What can we learn from all of that, and also in the way in which one is dealing with malaria today? What can we learn from all these experiences, and how can the EU learn from that and cooperate better with African countries? And then getting back to mental wellness, you spoke about that. And I remember mental wellness being really taboo in African countries. Did you observe a shift in this taboo now? Do people actually speak about what they're going through, and how do you deal with that?
Okay, so in terms of the partnership with the EU and Africa, I think the tragedy is that, and that with no disrespect to anybody in the rest of the world, because we have great partners and friends across in many countries in the world, but there is always, unfortunately, the haves and have-nots. And I believe that not one citizen on this planet is an island on their own. We are all connected. We all sit with a common denominator in the fact that we are human, and we have obviously our resource ability to roll out as quickly, perhaps because our technology in Africa, or particularly in certain countries, because some countries in Africa are advanced and others may not be. I think the partnership needs to be where masses of officials are able to help administer that rollout and make sure that herd immunity is achieved as quickly as possible. Because in the end of the day, it doesn't matter where you live. The impact of this virus, for example, is not uniform, no matter whether you have a skin color that varies across the planet. The impact is all the same. And some people of some advanced country will die from it, and some people from Africa will die for it. So it is in our interest to work as a united front, to have a whole of world approach to this pandemic, as we call a whole of society approach. And I believe the European Union can certainly learn from this whole of society approach. We're not an island. This is a very important continent in terms of the future and the future resources for both Europe as well as the rest of the world. And I find it terribly heartbreaking to see that, again, we are on the back foot. And there's certainly a lot more that we could do in partnership. Then in terms of and may I just remind everybody that there are pockets of excellence in Africa. So, for example, we did the first heart transplant. We've got very good medical skills. Why are we not cross-populating those skills? Why are we not utilizing where there are pockets of excellence to help boost up pockets in elsewhere and work across? I think we're too much in isolation, too much in silo thinking. Anita, and then of course, I couldn't quite remember your last question. Oh, in terms of mental wellness, the conversation. It's certainly become much easier to talk about mental wellness culturally across our communities. I think we just can't ignore it anymore. People are recognizing it. I think one of our greatest our challenge is trying to keep ahead of it. So as we talk about, and I know you will be talking about an increase in gender-based violence, that in itself still shows that we're not ahead of our game. We're behind it. And we're trying to reestablish as many jobs as possible, because a lot of it is based on economic destitution, hunger, just poverty. So many people have lost their jobs. And in a country such as ours, it doesn't have the financial resources to prop this up. This for us is a huge concern.
Well, thank you, Beverley, for stressing the fact that we really need to cross-copulate and that we are all equal in front of COVID-19, whether you are a president or a worker, whether you're white or black, we are totally all equal. People who have less space, people who have underlying issues are probably more exposed. But at the end of the day, we are all actually locked down as long as the economy is not moving forward, as the world is not opening and we're not seeing our relatives. Then I want to welcome our second speaker, Mr. Keita Mountaga. Before I go over to you, I want to ask one last question for the moment to Beverley, and we'll listen to the next presentation and we'll come back to questions for both of you, if that's fine. So my other question for you, Beverley, is how do you overcome difficulties because there are maybe not necessarily in your country, but in many African countries, there are infrastructure issues. So how do you overcome such difficulties and reach rural areas better? There is also a issue in communication, like for example in West Africa, like some people who do not necessarily understand what is being said on national television in another language. How do you overcome the language barrier and the infrastructure barrier in locations also where there is conflict ongoing? It can be a challenge. Do you have a piece of experience to share with us in that regard?
Assita, one of the projects that are doing a lot of work in Cape Town, they're building one of the largest blips, if you know, those floating large hovercrafts in the sky. And I think they have a contract with the Red Cross to deliver medication via these floating blips across into Africa. Now, what we've done, we utilize the private sector. So, for example, all our chronic patients obviously couldn't receive their medication at hospitals. So we partnered with Uber and local NGOs across South Africa, and we got Uber to collect their medication from our healthcare facilities, deliver it to the NGOs who knew who the patients were because they work in local areas, and deliver it to their home. Today, not one of our chronic medication patients has to receive their medication at a hospital. And that helped us a lot to prevent the spread. The second thing we're using is the concept of drones. Drone technology is being tested all over the world to deliver medication. And that's why I'm saying it is incredibly, where there are countries, particularly in Africa, innovation skyrockets because the problem gets solved. So partnering with private sector who is able to innovate with technology and drive these problems into solutions is really what Europe and that should look. They should open up their minds and work with the private sector.
This is very impressive. I totally support that approach. I mean, it's impressive how people in Africa with sometimes facing challenges do not look at the challenge as, look, I'm seeing a challenge, I'm standing here to look at it and stare at it. They just go around it, start being creative. And what you just said just remind me a lot of even my own childhood and how creative people can be even in finding ways to play and things to do with very little. It's really amazing. And I think this is, again, something that we should learn here, because saying that you've worked with Uber, with other companies in the private sector, is something that politicians here need to hear as well, and see that they can actually use the relationship with such companies. I see that that Keita is not online for the moment. Perhaps some trouble on the internet. I think that is also a common issue that we can recognize. So as soon as he's back, we'll just get in touch with him. We can continue here. You spoke about these seizing the opportunities with the private sector, and then I wonder, there are still barriers that remain in reaching intervention, because of course we just spoke about the internet connection, because of digital issues. So is the digital aspect of things also something that you have observed and that has been a challenge, or that brought an opportunity in the way in which you've addressed the crisis in your country? And something to add to that is about the financial relationship, the financial assistance, and the cooperation strategy with regard to Africa during a pandemic, not only for COVID-19, but we have seen that it happened also during Ebola in other countries. And I don't know honestly how it's going. For example, we cannot call malaria a pandemic, but it's a huge problem. How does the cooperation look like? And I wonder why we don't have a vaccine for malaria yet. Maybe because we don't have it in Europe.
Just maybe. I always believe there's got to be a huge amount of political will to find these vaccines. And
just a second, Beverley. I'm just going to say hi to Keita. Keita, can you hear me? Oh, you're muted. While maybe the techniques is helping you unmute, I will just let Beverley continue. Please go ahead.
So in terms of malaria, you're absolutely right. Malaria is still a terrible pandemic, and really the political will to find these vaccines, I think, should be fast-tracked. I mean, if we can, this is the point, and what my Premier says so very well. He says, never before in history was the health department able to build a hospital within 6 weeks. Well, during the pandemic, we built a hospital in 6 weeks. Now, it can never go back again that you're building hospitals in 3 years. So we really need to use the lessons we have learned across the world and fast track the opportunities such as finding vaccines for pandemics such as malaria. And then in terms of, Assita, in terms of innovation and technology, I think that is probably the biggest downfall is the unstable technology at times and possibly not consistent across, out of cities in the smaller towns. But we have found, though, that even in schools, in some of our poorest communities, very good headmasters or headmistresses who used innovation. Some were able to, in the most poorest of schools, set up an app they could find on Google Apps or iPhone apps, download it and get their children immediately onto online schooling. And even if that online schooling was on a small mobile phone. So there has been pockets of innovation, but I would certainly think that across the country and across countries, developing countries, particularly broadband would have been the biggest downfall during this time and made it very difficult for everyone to be able to have equal opportunity in maintaining or receiving existing work or doing their work. I believe that would certainly have been a failure because it's not consistent.
Yeah, thank you for sharing that again. I think Keita is still having, as we are discussing about the digital aspect, he's trying to get his microphone working. I think there are also other barriers that are possible to be dealt with regarding the matter of pandemics like COVID-19, also like malaria, like other issues. But I do hope that after this, nobody is going to ignore the fact that the world is capable of finding a solution against malaria. It's heartbreaking to see how many people are dying every year because of malaria, how many kids are staying out of schools because of malaria. And it's just it's a disease that can make you lay down for days and it can kill you very fast. I remember when we had malaria as kids, we couldn't do anything. I mean, you just get so weak, you can't eat. And I think people don't really know outside of countries that are touched by malaria how hard it is and how bad it is for education and for advancement of business as well. So maybe we will have this conversation again specifically about malaria. I would really like to hear your views more broadly another time because it's an important point to address. But in the meantime, I see that Keita, welcome. I'm glad you're finally connected. How are you doing?
Good, I'm very good. Sorry for the bad connection, but I had to switch the Wi-Fi.
Yeah. We're happy that you're here.
Thank you.
Well, I think I would like to introduce you to everyone who is following us right now. So Keita Mountaga is the founder and managing director of Tulip Industries Limited. Mr. Keita is a former banker who wants to revolutionize the medical sector. Tulip Industries is a startup active in the healthcare sector and seeks to revolutionize the medical sector with technological innovation. Mr. Keita holds a double master's business administration and purchasing, procurement, acquisition, and contract management from the University of Maryland and holds a diploma in negotiation and conflict resolution from Harvard Law. Thank you for joining us today. I'm very proud to introduce you to our audience, and I would like to give the floor to you for your presentation about this topic.
Well, thank you for having me. Sorry for the connection again. I'm Mountaga Keita, and what we do here in Guinea, we try to revolutionize Africa the way we do things through technologies. For example, interactive kiosk that can be deployed in rural areas, because we know in Africa most of the population live in rural area, like from 60 to 70% of our populations. Now we have now those digital equipment that can go far beyond where the electric grid stops, and also tablets, also like the COVID scanner to scan the symptoms of COVID, reveal the vital sign, and through that doctors can assess if there are risks. So that's what we do. And right now we are evolving in this pandemic situation where things are really now getting harder. The international logistic chains are really tougher, more expensive, but anyway, we are still inventing, innovating, and then we are working with the World Bank, other international institutions like the World Food Programs also to build the devices they need to impact our populations. And that's where we are right
Well, I'm very thrilled to see how Africa is actually leading technologically, and usually it's not something that is very much discussed about in Europe. I am mostly irritated when I hear conversation about Africa here, that it's mainly about aid only and not about the potential that is already there. And as a former person who worked for a bank before, I can imagine the perspective that you have on all the opportunities that you see, and you may also maybe get impatient or wonder why others are not seeing it. Can you share maybe that feeling with us?
now. Yes, if I didn't hear the last second, please,
I say
about the opportunities.
the impression that we can have sometimes that all the opportunities, despite the difficulties that are there, that that others, why don't they see it? Is it something that you also experience, and would you like to share that with us?
Usually we have the stigma that, okay, we live in Africa. Africa is ridden with disease, pandemics, left and right. But it's just a stigma. It is not true, really. I used to live abroad in Europe and in the US for 23 years. So watching Africa through the TV, what TV says, what TV channel says, that's what we believe in. So myself, I almost believed into that. But often I started like to go on vacation in Africa, in my native country, in Guinea, Conakry, and I found out that the reality is pretty different. And Africa is more modern than what TV channels like abroad like says.
Dave.
Africa is not about like lions and then giraffes and then the first time I met a lion was really in the US in a zoo. It wasn't in Africa. The first time, and I was asking America all the time, oh, do you see lions and hippopotamus? I say, no, I don't even want to see them in Africa. Otherwise, I will be a burger for them. They will eat me. There, we don't have 911 to come and save us. If you meet a lion, the lion sees you, you're done. So
Then it will
it
think
was
there is a party here, see nice food coming. I
it
think
is the stigma. And then now I come to Africa, I see people are on 4G connections. They know more like innovation throughout the world than me because I was in America, and America is pretty close to America. And in secret, I have to tell you, I had to catch up. I had to catch up here when I came back in Guinea on things that I didn't know because I was in a bubble in America. And when I came here, the bubble burst, and I found myself, okay, I'm from Washington, D.C. area, I'm from Harvard, but well, I knew my books, and people here really knew life. And I had to relearn really what is real life. Real life is here in Africa. I'm sorry, but that's the reality. So I caught up. It took me like a year and two to really catch up. And that's when I started now to see opportunities. Whatever is missing here, I see some people crying, yes, we don't have this, we don't have metro station, we don't have. I say, well, there's no metro. Invent another way of transportation. For example, in Rwanda, they don't have like roads to go in every village, maybe. They innovated drone. They brought like a company that use drones, um, UAVs to send like blood like to people in remote areas. So I see now every single gap. Whenever I see one of my fellow countrymen cry on something, I really ask them, okay, are you crying on what? Can I solve it? And when I solve that, I put money behind, and that's a business. So I see Africa as more like a land of opportunity where you can create billions. We started at Tulip Industry with zero because imagination costs nothing. So we started with imagination. Everything started with that. But today, when we did the valuation of the company in 2021, it is over $45 million, the value of the company. By next year, as we go in Africa, we stand with 23 countries to expand our reach. The valuation is tending to be around $219 million, the value of the companies. And everything started with zero. And for the next 5 years, it even scares me to look at the numbers if we go the way we are going, because now we're talking about almost $2 billion valuation. And that's scary because I'm not used to that kind of amount of money or value of the company. But that is in Africa. Just taking countries one by one, that's what we did. And we're 23 countries. We're trying to expand to all 54 countries if we can, and then bring your technologies there. So, a lot of opportunities in Africa. You just have to come in, spend at least 6 months. If you come to Africa for just a week, I'm sorry, you will not see anything. For even a
Then you are
month,
a tourist, aren't you?
oh, if you are a tourist, oh, sorry for you. You won't see anything but what you want to hear. They will tell you, and usually you will meet more crooks than real people. But if you spend 3 months, you will start to feel
Beverly
Africa.
was also telling us. Oh, Beverly was also telling us about the innovation, the cooperation, the private sector. I'm glad that your initiative has done very well. Really proud to hear young African people moving forward like this, and it gives me a lot of. I wish I could just after this call fly to Guinea and celebrate these things, but well, I can't. So maybe when the pandemic is over, we can have a look at all this. But this innovation and this working together with the private sector, between politics and private sector, is very important. During this pandemic, have you observed more of that cooperation also from your side, Keita? And do you think um, it has affected your business in a certain way? This pandemic, how it happened?
The pandemic has really affected the business because pre-pandemic we're negotiating with some international institutions like the World Bank, for example, the World Bank Finance or Agriculture Ministry, so we can digitalize agriculture in Guinea throughout all devices. And also the World Food Program also because they feed children in schools in rural areas. So we're digitalizing that. We are on the deployment phase right now. But those negotiations were done in 2020, just from 2019 to 2020. So
Mm.
we set a price. But now what happened is like locally in African countries, they don't accept now to be paid in foreign currency, but in local currencies. So we converted the dollars after negotiation, the dollar into local currencies in 2020. But with the pandemic, then we had issue in the conversion. So we
Mm.
lost almost 20% of the revenue just through the conversion because our currency dropped the dollar went higher, the euro went in another direction. So it's really affected. So at the end, we even recorded like a slight loss just due to the pandemic because of the conversion rates. But another aspect is like the international logistics. Have you seen, for example, the ship that the Evergreen stuck in Egypt in the Suez Canal? That affected
Mhm.
us because they had more than 400 ships stuck and were stuck there in the canal that couldn't pass. And we had our raw materials in there coming from Asia, coming from India, coming from everywhere. So that was a huge problem. Sometimes you see things on TV and then you panic and people ask you why you panic because you have your raw materials coming. So what we did then, we had to ship some raw material by plane, for example, using those express company, DHL, FedEx, and all those companies. But they started charging at premium rates, so everything became much more expensive while we negotiate those contracts early, a year earlier, pre-pandemic. So we had to swallow the difference because it's really like costed us like money, like at least I can say 20% of it. But we know the pandemic will finish. But another good thing is with the pandemic that
I
the
hope
more
so
the
that the
the
pandemic will
more
finish.
yeah, the pandemic also is an opportunity for Africa to catch up. Because of this pandemic, also we had huge number of institutions that came to us because we had those devices to scan uh, people, like for the COVID, for example, or their health, to reveal their vital sign and then see if they're suffering from another thing. So yeah, the pandemic also was an opportunity for us and for Africa. The pandemic will really help us catch up on some
I
areas
think, I
because
mean, you sound like many of these young business people I met in the Abidjan. When you go to the Abidjan city, for those who go to the city in London, well, when you go to Abidjan and you go to the plateau, you kind of see the same dynamics with young people who have watches, who are very much in a hurry, who see opportunities everywhere. So I hope one day to see them on television and see young people like yourself also on television here, and not only just the old story repeated over and over again. Although Africa is a place of opportunities, it is also a place of challenges. You know, we cannot have opportunities without challenges. So I would like to address. We still have 10 minutes to go, and I really look forward to speak to you two again after this is done. But let's make use of these remaining 10 minutes. This following way, I'm suggesting that I will ask you to both of you two questions, and maybe you have each of you, maybe Beverly has a question to ask Keita, since you have heard his presentation and his answers. So my question to both of you is related to the 2030 development goals. Do you believe that the COVID has significantly set back African nations in reaching these goals? And regarding vaccination, there is a lot of disinformation and a lot of anti-vaccination movements. We also see it in Europe. Uh, is that also something that you have been observing in Africa? And are there digital campaigns from organizations or governments to combat this? What has been your observations? And so if you want to answer these questions, and maybe Beverly, if you do have a question for Keita, please feel free to ask it as well.
Thank you very much. It's good to see Keita here, because a year ago, Keita was very much talking about the beginning stages of his business. So,
Yes.
you know, he's a perfect example of where there's a need, there becomes incredible innovation. And so this is why I say there are just these incredible pockets of excellence that the rest of the world can use and invest in, because this is going to be the fastest growing economies going forward. I mean, our economies have been decimated. So there's only one way, and I believe it's got to be up. So we're on a good innings here. If we get the investment, we've got the innovation, we've got incredible people that can take innovation forward, in particular in the healthcare, and Keita is certainly one of them. Sorry, Assita, there wasn't a question but a comment.
No, but it's fine. I think we're all learning from it. Thank you.
Yeah, and I think in terms of the 2020 development goals, certainly it could certainly have an impact on achieving some of those goals. So if government has wasted money, like our national government has, and tremendous amount of corruption as a result of the pandemic, that those funds cannot be put back and people will suffer. So where we're going to find the budgets, our budgets have been cut more than, billions have been cut from our own provincial budget as a result. I believe the poorest of the poor will suffer, and so the 2020 development goals are at risk. And we're going to have to work incredibly hard, and possibly, as I say again, in partnership to try and remain on track. And then in terms of the anti-vaccination movements, most certainly, people have a lot of time on the internet to watch YouTube channels, and there has been a lot of mistrust around vaccinations, and we've had to work very hard on ensuring, again, transparency, because I think, conspiracy theories are based when people don't, or politicians or governments are not transparent and don't take their public with them and are not showing this data. We believe an evidence-based approach to solving all problems is what we stand for in our province, and we believe that's the way to mitigate any anti-vaccination movements that are uncomfortable. And I have to say, though, our government at both provincial and national has indicated that no one will be forced to take a vaccination. But the question really then lies is, how willing are you to infect anybody else that may lose their life? So it's a very difficult situation we find ourselves in.
Yeah, well, thank you. Keita, do you have any comment on this one?
Yes, on the goal, we will get there eventually. Like Miss Schäfer said, and corruption is what destroys things slowly. Corruption is just like a hole on a bucket. No matter how you fill it in with water or good things or with huge budget, with corruption, with those holes, you will lose the essence really, and you won't be able to impact it. Whenever some people suffer, some other people will try to gain advantage on it, and that's where corruption kills things. I've seen corruptions really throughout these pandemics, ordering things that are not supposed to be ordered, and everything happens with this. People are trying to get money. But on the other side, the vaccinations, I believe in, because some of my family get the disease, also the virus. They came through it very well after 2 weeks. Some are vaccinated, and they tell me to get vaccinated. I say, well, if I get the Russian vaccine, Sputnik 5, okay, but the Pfizer,
So
I'm not getting.
I was literally thinking I'm going to ask, are people afraid of receiving the Chinese or the Russian Sputnik,
Well, the
or they're looking
Chinese,
forward to have it?
after studies in the US, the Chinese vaccine is not efficient. So even in my country here, it is so available that I really, it begs the questions. Why is it so easy to get this vaccine here while the Sputnik 5 is only inoculated to really ministers or the president or the head of the parliament? They're getting Sputnik 5, but
So
for
there
the
is a question
population,
of there is a
they're
question of
getting
trust.
yeah, they're getting the Chinese one. It is not a matter of, it's not an issue of price. It's not an issue of price, but it's just that we are wondering really
Yeah, there are a lot of
why
question marks.
some very wealthy people, very powerful people are getting the Sputnik 5, while the very poor are getting the other one. So that's the question also. Well, if I get the vaccine, yes, I will take it. Some are getting even sick with the vaccine. But what I believe in is that we will come over to this pandemic throughout natural or throughout our antibodies. We will develop it. We will develop
On
antibodies
this
that
note
will.
of very optimistic approach, I will unfortunately have to end our sessions over very only a couple of minutes, but I really did like this conversation. I found it inspiring. My key takeaways, there are so many, but I will only quote 3 to 4 of them. Just be optimistic. I think that the Western world, by patronizing and being arrogant about countries smaller countries in Africa or in Asia has missed an opportunity to learn and to take over and to share best practices. I think that is a pity. We need to change that in the future and have better global preparedness. I also think that you mentioned, Beverley, you spoke of a pocket of excellences cooperating with the private sector, including Uber. And it makes me see like an Africa that is building, an Africa that is growing, and this needs to be much more visible. I also note the point on corruption that we will not be able to address now, but it is a huge issue that also China is feeding. We've seen it strategically. This is a point that Africa needs to address and that the EU needs to take into account in its strategy, in its relationship with Africa. So I want to thank both of you very much for your contributions, for your inspiring contributions here today. There is still so much to exchange about. And so I'm very excited and hope to see the two of you during the big African summit, maybe physically. I also remember meeting Keita. I think I met you in Brussels and you were so excited. You were all full of a lot of energy. And Beverley, I see you smiling. You two have all this energy. So I'm like feeling a lot of energy now that I've spoken to the two of you. So, and my team is teasing me because they can see the energy rising on my face. So I hope your families are well. I hope we will discuss again about these issues in person. So I will leave the floor to my colleague, Anna Fotiga, who helped organize. We started this initiative together, and our next session will soon be started, and it is about the influence of global actors on Africa and EU-Africa policies. And it will be chaired by MEP Anna Fotiga. Please head over to our website at ecrgroup.eu/event/looking ahead EU-Africa for the link for the next session. I wish you, Keita and Beverley, a very nice day, and I look forward to seeing you in person. Any last word you want to say is still possible if you share 1 minute. That's the length for us to talk in Parliament.
Assita, thank you very much. It's a great opportunity. It's all about communication. It's about learning and sharing, and I thank you for this. Thank you very much.
Thank you.
And also thank you. Yes, like Ms. Schäfer said, it's all about communication. And like we like to say in Guinea, we are together. So let's do this.
And how do you say that in Guinean language? We are together in your Guinean.
In French, we say on est ensemble.
On est ensemble.
On est ensemble. Nous sommes ensemble. We are. Voila. So thank you very much. We are positive, and let's make this Africa work. And because this is the best continent to my eyes for opportunities right now. Yes.
Thank you very much. The only thing I disagree about Europe is great too. Thank you, and have a very good day.
Thank you. Okay.
Bye, both of you, and take care.
Bye now. Yes. Mm-hmm.